Imagine that you are a healthcare provider and a patient presents with injuries that might be signs of domestic violence. How should you approach this situation? To empower survivors, we want to normalize these conversations with empathy. When screening the patient, it's important to maintain an empathetic and non-judgmental tone. Open the conversation with a neutral statement to build rapport, such as, "Because domestic violence is so common in our patients' lives, we have started to talk to everyone about it."
If the patient is willing to continue the conversation, consider the following questions to assess your patient's circumstances. Does your partner respect your choices? Or, does your partner respect your space and time spent alone with friends and family? When evaluating the victim's safety plan, discuss concerns and encourage help-seeking actions. When documenting, remember to express compassion, sympathy, and affirm that the abuse is not the survivor's fault. Ensure that you are documenting the patient's statements accurately and avoiding information that distorts the patient's words.
When it comes to intervention, it's important to reassure the patient of their confidentiality and requirements you must adhere to in reporting abuse. Try your best to empower your patient and respect their autonomy in the process. Some quick do's and do nots. Do. Tell them you believe that they know what's best for them. Inform them of resources that can be helpful now or later. Ask your patient what would be most helpful right now. Do not. Tell them what they should or should not do.
Lastly, when your patient makes the vulnerable decision of accepting help, do your best to connect your patient with a domestic violence hotline, with important local community agencies, and help your patient complete a safety plan. Remember, it takes on average 4 to 7 attempts before one leaves an abusive relationship. As a provider, staying vigilant, patient, and empathetic are key elements to empowering survivors of domestic violence.
If you're in the local Houston area, here are some available resources for your patients. These organizations offer various emergency services, legal counseling, financial support, housing intervention, companionship, 24-hour hotlines, and many other resources. Also, many of these organizations offer training, education, and support for those who wish to learn more about how to help victims.
If you or a loved one is experiencing domestic violence, please call 713-224-9911 to reach the Aid for Victims of Domestic Abuse hotline.